So what if I told you people with narcolepsy don't just struggle with falling asleep at the wrong times, they're also plagued by extremely vivid, really elaborate nightmares.
So narcolepsy has an elevated rate of nightmares. Around 30 to 40% of people are having at least one nightmare a week. You can wake up feeling really anxious or panicky, and they can really affect you the next day. You might keep thinking about that nightmare, flashbacks to it. It almost creates like a false memory. You actually think it happened.
Hello and welcome to Sleep is My Waking Passion, the podcast where we get real about sleep and how it shapes your life. I'm Dr. Alison Kole, a triple-boarded pulmonary critical care and sleep medicine physician who's learned to thrive despite having chronic insomnia. And now I'm here to help you do the same.
I have a really cool guest for you today. The topic today is going to be nightmares in patients who have narcolepsy. So what if I told you that people with narcolepsy don't just struggle with falling asleep at the wrong times, they're also plagued by extremely vivid, long, and complex and sometimes negative nightmares. They have these really elaborate nightmares. What if I also told you that behavioral treatment can actually help with these nightmares? This is not something that's really talked about in the narcolepsy space. Well, today we're going to be addressing this topic, and this topic really, quite honestly, does not get enough attention in the narcolepsy space. I've actually not really heard it talked about. We pay a lot of attention to research involving pharmacotherapy, but the behavioral aspects of what we can do to help narcolepsy patients, I think, is something that's long overdue. So I'm very excited to bring with you a researcher who is extremely well known in the field. She is extremely busy. Her name is Dr. Jennifer Mundt. She happens to be a clinical psychologist and sleep researcher, and she recently joined the University of Utah. Her groundbreaking work is revealing just how devastating nightmares are for people living with narcolepsy and how cognitive behavioral therapy might actually be a key to relief. So in this episode, you'll discover why nightmares in narcolepsy are different from typical bad dreams, what her research reveals about their impact on quality of life, and how CBT techniques can be adapted for this unique population. If you treat narcolepsy patients, or if you yourself struggle with sleep paralysis and nightmares yourself, this is a conversation that I think you need to hear. So before we get into that, if you're finding this topic as fascinating as I am, I'm so excited for this episode, please hit subscribe and leave a review. It helps other clinicians, it helps researchers, and it helps people who either suspect they have narcolepsy or people who actually do have narcolepsy discover conversations that might change how they think about sleep disorders. Stick around to the end because I asked Jennifer a question that makes her think outside the lab. Welcome, Jennifer, to the show.
Hi, thank you so much for having me.
So I wanted to start with the basics. When we think of narcolepsy historically, this is a disease that is rare, and the people who are hanging on and listening, I think they're probably going, oh, I kind of know what that is, or I've heard of that term. You know, we typically think of people who can't keep their eyes open. They have excessive daytime sleepiness. They may wake up and they can't move their body, what we call sleep paralysis. Or around the transition from sleep to wake, so they're falling asleep or they're waking up, they may actually feel like they're sort of dreaming and awake at the same time, what we call hallucinations. And then for certain types of narcolepsy patients, specifically the type 1 narcolepsy patients, they may experience particularly positive emotions, like they're really excited, they're laughing, and then suddenly they may experience some form of a muscle weakness episode, what we call cataplexy. Why should we be paying attention to nightmares in this population? Can you talk to us about that?
Sure. I will say just in general, nightmares get overlooked. So that's true in narcolepsy, but that really is just true in general. Nightmares are actually quite common. We know that it's really normal in childhood to have nightmares, but even in adults, about 5% of the adult population has frequent nightmares, like at least once a week. So that's like 1 in 20 people. And that's more common in narcolepsy. So narcolepsy has an elevated rate of nightmares. Around 30 to 40% of people are having at least one nightmare a week. And nightmares are not just sort of a silly thing like, oh, it's a bad dream. They can be really impactful. They can be extremely upsetting and distressing, really disrupt your nighttime sleep. You can wake up feeling really anxious or panicky, and they can really affect you the next day. You might keep thinking about that nightmare. You might almost have kind of flashbacks to it. It can be hard to shake off. Nightmares are something that really do impact people, and they sometimes may even be a little ashamed or embarrassed to bring it up. They might think, oh, this shouldn't bother me. It's just a dream. But they really are something that that's really upsetting. So it's something that I think we just need to be paying more attention to, because like you mentioned, the sleep paralysis and the hallucinations we know are a common thing in narcolepsy, especially the type 1 that has cataplexy. But nightmares may be as common. There's not as much research on that. But I think for some reason they've just kind of gotten overlooked a bit.
Is there something unique about the nightmares that a person with narcolepsy would experience versus someone who does not have narcolepsy? Are there certain features about it?
I think there are. And again, there's not a ton of published research in this area, but sort of based on what's been published and then based on my own experience from seeing people in my clinic and then also with a pilot study that I did, the thing that I think is really unique is the fact that people do also frequently with narcolepsy have things like the sleep paralysis and the hallucinations. They also have dream enactment, and those things can combine with nightmares. So if we think about like sort of the most common sort of prototypical nightmare patient that I would see in the clinic is someone who has nightmares that are related to trauma. That's the most common. Typically, those people are not going to say that they're having sleep paralysis or hallucinations. The dream enactment can happen sometimes with trauma. But those symptoms are very common in narcolepsy. And what I hear from people is that those can combine with it. Then there's also some other unique features that include lucid dreaming. People with narcolepsy are much more common to just be natural lucid dreamers. And that just means that you are aware that it's a dream as it's happening. You can have that lucidity, that awareness with or without the ability to control it. So there's a couple studies showing that lucid dreaming is much, much more common in people with narcolepsy. When narcolepsy in general, people have really vivid dreams. And so that can also lead to this thing we call either dream delusions or dream reality confusion are the terms for it. And basically what that means is the dream seems so vivid and real, and it almost creates like a false memory where you actually think it happened. And this could last for a little bit the next day, or it could last for days or weeks. You may not even have any inkling that it didn't happen until you encounter something during the day that makes you realize, oh my gosh, that didn't actually happen. I didn't have that conversation with this person, or I thought I sent that email and I didn't because I got in trouble at work. So that's also a thing that's very common in narcolepsy. There's just one study on that, but over 80% of people with narcolepsy have that dream reality confusion and have it pretty frequently, as opposed to, I think it was around 15% of people without narcolepsy. So you can imagine having a nightmare, not just the distressing dream, but maybe you're waking up in a sleep paralysis, maybe you're screaming and acting out your dreams, maybe you are waking up and then being unsure whether it happened. There's kind of these additional elements that can happen with narcolepsy.
And narcolepsy, we know, is sort of a issue with sleep and wake and essentially REM sleep regulation and wake. So when you say dream enactment, is this kind of a form of REM behavior disorder? Would that be an accurate description, or is it a little different when they're like acting out their dreams? Yeah.
Yeah, in the literature, it's usually termed as narcolepsy-related REM behavior disorder. So as opposed to the sort of the isolated RBD, which is when we don't have an identified cause, or it might be like Parkinson's related RBD. This would be if someone has narcolepsy and it's, we think that it's due to that, it would be called narcolepsy related RBD. The literature says that the dream enactment doesn't seem to be quite as intense in narcolepsy. It's maybe a little more subtle, not as violent, and maybe not as much correlated with nightmares. So I'm actually doing a pilot study right now treating nightmares and RBD and sort of learning more about how maybe those nightmares are different. And those tend to be really violent and sort of aggressive in nature. But there's some indication that maybe in narcolepsy, that the nightmares and the RBD might not be as closely linked, and the dream enactment or RBD maybe isn't quite as intense.
I did not know that occurred, though. Okay, mind blown. Mm-hmm. Just learned another thing about our narcolepsy patients. Has there been any published data or even your clinical experience that you're seeing is there any difference between basically quality of life, mental health issues, disease burden even in narcolepsy patients versus someone else who has nightmares or someone who's a non-narcoleptic suffering with nightmares? Is it adding, it's already very difficult to live with narcolepsy in terms of the symptoms of being tired and all the other downstream effects of that. Is there another layer that nightmares adds to that?
My clinical judgment and experience is yes. I can't think of any actual published data looking at that. There's not a lot really looking at the nightmares, and I can't think of anything that's comparing sort of like trauma-related nightmares to narcolepsy nightmares. But I think it's worth investigating, because I think there probably is. Like you said, there is a lot of research just showing that with narcolepsy in general, that there are higher rates of depression and anxiety, and it just really impacts people's whole lives, right? It affects their relationships and their work and so many things. You can imagine having that kind of at baseline, that maybe having these nightmares, or even things like going through your day thinking your nightmares actually happened, right? That can affect your relationships. That's the thing I've definitely heard from people, where during the day they'll like feel shame or feel weird about certain people and feel bad in social situations because they feel like they did something wrong, and it comes from a dream that they had. So it can sort of influence your daytime. But yeah, I don't know that we have data to back that up, but my suspicion would be, that it just sort of adds another layer.
In terms of treatment, let's get into that a bit, because when I think of cognitive behavioral therapy, I'm thinking of the specific tenets that we typically do for insomnia. But I'd love to hear, how is cognitive behavioral therapy framed for nightmares, for narcolepsy, or in general, if they're similar?
Yeah. Let me back up for just a second and sort of clarify a couple of terms, because I think people listening to this might have heard some different terms for this treatment. And even in the most recent American Academy of Sleep Medicine position paper, which is a little old now, I think it's about 10 years old or so, they use the term imagery rehearsal therapy, RT. So that's a common term that you'll hear. That's kind of traditionally been the term for nightmare treatment. And then more recently, there's some folks led by Christy Pruxma who are putting together, trying to sort of standardize the protocol for nightmare treatment, because IRT actually wasn't super standardized. Some studies it was 1 or 2 sessions, some studies it was 6 sessions. There's sort of different elements that could be included. So their group has been trying to standardize and come up with sort of this package called cognitive behavioral therapy for nightmares, or CBT-N. So that's sort of the term that I use now. It's similar to CBT for insomnia, where it kind of combines these multiple strategies, and we're putting those together because we think that each of those strategies does something to address factors that are contributing to nightmares. So CBT-N is like roughly a 6-session treatment, and it includes things like some education. Let's talk about nightmares, why we think they happen. Let's talk about sleep, and sort of addressing some general sleep habits. People with nightmares often have insomnia, so we might be doing some things with general sleep habits, a little bit of almost CBTI strategies to help with the insomnia, and addressing insomnia itself can also help with nightmares if we can get the sleep more consolidated and more consistent. So we do some general things like that with sleep habits. And then we really focus on bedtime relaxation. The idea, there's this mood matching theory that our daytime mood, and especially our bedtime mood, really affects our dreams. So sort of more than the actual things we experience during the day, we don't necessarily dream about those, although we might, but that mood from the day will really color our dreams. So if you're going to bed feeling really angry and upset about something, you might have dreams where you're feeling angry and upset, and your brain's going to make a story around that emotion. So what we want to do is try to create sort of a buffer at bedtime and really help let go of the tension, stress, negative emotions, get your body into a relaxed state. So we focus on having a relaxing bedtime routine and doing some formal relaxation practice, things like deep breathing, progressive muscle relaxation, to help with that. And then the imagery rehearsal part is also included. And that's where I always tell people, this sounds a little strange, but it really does work. It's a really cool therapy where we literally rewrite your nightmare. If you're having a recurring nightmare, or maybe it's slightly different each time, but it's kind of the same theme, we're going to look at what that original story is, and then we're going to rewrite it so that it's no longer a nightmare. So you're going to come up with however you want to change it. And we're going to make sure that we change all those key parts that are really the negative parts. And then what you're going to do, so we call it imagery rehearsal. Part is at bedtime, you're going to visualize that dream. You're going to think about it and sort of let your brain absorb that new dream. It's going to sort of create this new path for your brain to go down, because nightmares just become a bad habit. Like your brain just kind of gets stuck in this broken record, and it just goes down that same story path every night. So we're helping to shift it, kind of get your brain unstuck by rewriting that story and practicing it. And then it really does change what you dream about. People don't usually come back saying that they remember having that rewritten dream. They just say that I'm not having the nightmare anymore, or I'm having it, but it's really different. It's not bothering me. So that's sort of typically what happens. Those are really the key elements of the CBT for nightmares. And then I could also talk about some of the adaptations for narcolepsy, but it includes those same components.
For curiosity, because you mentioned that folks with narcolepsy may have a tendency to be a little bit more likely to have lucid dreaming, do you find that if you're doing imagery rehearsal, do they take that, and if they have a different dream, let's say, can what they're taught about how to do imagery rehearsal when they're awake, can they segue that into almost lucid dreaming their way out of different nightmares? Is that a technique that you've seen them do?
Yeah, absolutely. And there is such a thing as lucid dreaming therapy that specifically focuses on that. I sort of incorporate that into the CBT for nightmares. So lucid dreaming would be like you're re-scripting the dream in real time as it's happening. What we typically do in CBT-N is we sort of re-script it in the therapy session. Okay, this is the dream you remember. Let's rewrite it now and imagine you having it differently in the future. But it's kind of the same technique. It's just, are you doing it when it's actually happening, or are you doing it sort of before the fact or after the fact? But yeah, people who have that ability to lucid dream or have trained themselves to lucid dream, if they have control over it, can just change it in real time and make it go in a different direction. Or some people will choose to wake themselves up, but they can control it and change it so that it's no longer a nightmare. And so when I'm doing the re-scripting with people that do have that lucid dreaming aspect, we can include that as part of the story. So maybe in the story, you're becoming aware that it's a dream. You can sort of visualize this ahead of time. It's sort of like, like athletes will do like visualization, like practice themselves or visualize themselves making the free throws or whatever it might be. They're visualizing it ahead of time. So imagine yourself having this lucid dream and you're changing it as it's happening. You can visualize that, sort of prime your brain to be able to do that when you're asleep.
So cool. You mentioned some additional aspects to CBT-N for narcolepsy. Can you get into some of the other additional things that you might do for a narcoleptic or a patient living with narcolepsy who might be experiencing nightmares?
Mm-hmm. So a couple of the biggest changes, and so I did a pilot study on this, and this is where I kind of developed those adaptations, and then I'm currently getting ready to launch a larger study. So the couple of the main adaptations, so one was adjusting how we do that re-scripting. So like I was mentioning, you can include the lucid dreaming, but we can include those other things. So if their nightmare includes, let's say, waking up into sleep paralysis or hallucination, that's going to become part of the story that we're re-scripting. So I think of this as like, it's usually we refer to just like the dream mentations, sort of the thoughts that's kind of what a typical nightmare is just this thing happening in your head. I think in narcolepsy, it's more this episode that includes that sort of imagery in your mind, but then it may also bleed into that wakefulness, that kind of in between where you're half awake and you're having sleep paralysis or hallucinations. So we can include that and sort of re-script all of that. Another key thing to adjust is how we do both the imagery rehearsal and the relaxation. So we want to think about the timing when that's going to be most feasible and also safe. So let's start with the imagery rehearsal. If we ask people to do this at bedtime. Close your eyes, visualize this story for 5 or 10 minutes right before you go to bed. For someone who is extremely sleepy, even during the day, right before bed, that might be impossible. They might just instantly fall asleep. They're not going to be able to get through the story. So we may want to have them do it at a different time. Maybe let's do that earlier in the day when you're more alert. We don't necessarily have to do it right at bedtime. That's just kind of the way we've traditionally done it. Or maybe we rehearse it in a different way. Maybe you keep your eyes open. Maybe instead of just thinking about it, you write it out or you draw it. Something that's going to allow you to stay more engaged and alert so that you're able to get through the story. So we can do that in many different ways. And then likewise with the relaxation, typically in CBT-N, we ask people to do this twice a day. You do it once during the day and then at bedtime following that imagery rehearsal. And we want to think about when's a good time to do that. During the day, I've had some people with narcolepsy say, well, if I did that during my lunch break, I'd fall asleep and then I'd be groggy the rest of the afternoon, or like it might not be safe. It might not be feasible for them because it's going to disrupt their functioning. So maybe it's not feasible to do that daytime practice, or maybe they just do a little bit. Or again, maybe they keep their eyes open or they stand up so that they're not falling asleep accidentally. Likewise at bed, maybe it's not right before bed, maybe it's a little earlier, but we want them to still just get that benefit, even though they don't have trouble falling asleep typically, but we want them to just get their body really relaxed. So we might just be adjusting the timing of that or the length of it or sort of the exact way that they're doing it.
You know, a lot of the studies that you have mentioned have been smaller studies that you've been engaged in. That's what we refer to as a pilot study. It's a small number of individuals, but now you're having a signal there that there might be something real here. So now you want to recruit more patients. Are you doing anything remotely in terms of, do these need to be done in person one-on-one? Are you offering any telemedicine style visits for people who are actively participating in any of these trials? And if so, do you have a website or anything for anybody listening who might be like, I'm having this and I would love to participate and understand and learn about CBT-N?
Yeah, I keep a list of the clinical trials on my personal website, which is jenmundt.com, JENMUNDT.com. You can also find these on clinicaltrials.gov, or for the narcolepsy nightmare study, it's called the DAWN study, DAWN, Decreasing Nightmares in Adults with Narcolepsy. You can email dawnstudy@utah.edu. That's the email for this current study that we're going to be starting recruitment soon. And that's for people with narcolepsy and nightmares. You can have either type 1 or type 2. So you can feel free to email us there. Clinical trials for narcolepsy like this also get posted there's some great patient advocacy organizations that will post studies. So you can look at Wake Up Narcolepsy, Narcolepsy Network, Hypersomnia Foundation. Those all will typically list various studies and clinical trials going on. Those are great resources. And yeah, for my clinical trial, it's the treatment's going to be delivered via video conference. That's what I've done now in multiple studies. It works well. I think everyone really got used to that with the pandemic. Even aside from that, it just makes it much more feasible for people to participate, right? You don't have to drive to a university or a clinic every week, which is great, especially if you have a lot of sleepiness and driving might be something that's difficult. It saves you a lot of time. And then it also just makes it easier for us to recruit people. Since this is a more rare condition, it allows us to be able to get people from all over the country. And that's the way we did it in the pilot study and in some other studies I've done. And yeah, generally doing that via video works just as well as doing it in person.
Awesome. Okay. So I brought that up because hint, hint, wink, wink. I'd like people to hear this. Your episode is going to be, I think, specifically relevant for June. That's PTSD Awareness Month. And so I wanted to make sure your episodes get rolled into that because I have another episode on nightmares for folks that don't necessarily have narcolepsy and talking a little bit about that with Courtney Worley. So as we wrap up, I have one final question for you. Actually, two. All right. Before I ask my final question, I do have one thing that just popped into my brain as you mentioned type 1 versus type 2 narcolepsy. Do you ever notice a difference in the types of nightmares from one, or is it all kind of lumped together, type 1 versus type 2, or they kind of have similar types of outcomes or observations regarding nightmares?
I think in my clinical experience, nothing has stood out as being too different. Just in nightmares, just looking across whatever other factors people have going on, whether they have trauma or not, whether they have narcolepsy or not. There are just kind of themes that tend to come up with nightmares, and frequently nightmares are about things like being in danger, being unsafe, not having control or power, and like not being able to trust people. There's just these themes that tend to come up, and I generally find that those same themes come up sort of across types. Now, there may be a little bit different, like I was mentioning with RBD, where those tend to really be more focused on sort of the violence and aggression, more of the safety, but nothing I've noticed is too different. In the research, the little research we have that's looking across types, the narcolepsy type 1 has not only a little bit more nightmares, but also more of the hallucinations, paralysis, and dream enactment. So they're probably more likely to have that sort of in combination with the nightmares. That's something where we do need more research to understand sort of how those dreams and nightmares might be different. And I'll just add for anyone that's sort of not aware, there's also this condition called idiopathic hypersomnia, which is very similar to narcolepsy type 2. And actually those two conditions can't be super reliably distinguished. We just don't have really the best testing methods for that. And idiopathic hypersomnia is a disorder where people have this extreme sleepiness and sometimes are sleeping a really long time, and it's called idiopathic because we don't actually know what causes it. It may actually be several different underlying conditions. We just don't know the causes yet. So I kind of think of narcolepsy type 2 and idiopathic hypersomnia as kind of falling into the same bucket. There's a lot of overlap, but I've also treated people in my clinic with idiopathic hypersomnia who have nightmares and have had success treating that. That's something that I'd like to do research on. But the research does show that the nightmares are as common in idiopathic hypersomnia as they are in narcolepsy type 2, which makes sense if we think of them as like kind of falling in the same category a bit. But we definitely need more research on that.
You had mentioned something in passing as part of the education that you do with CBT-N, which is why we have nightmares in the first place. Why do we? Why does that have to be part of how our brain operates, especially if it's unpleasant? I'm curious.
So one aspect is the mood matching that I talked about, where our daytime mood can affect it. So I think we've all had the experience of even just having some kind of transient life stressor thing going on, and you might have a nightmare, a really bad dream, just kind of an isolated incident, but it's tied to what's going on with your mood. But that can affect people even who have chronic dreams or nightmares. They're going to be more common if your mood is worse. There's also this idea of this sort of unfinished trauma processing. So if we think about trauma, which could be just a really stressful life event, something that involves actual or threatened or witnessed harm or death or abuse to you or someone else. Nightmares are extremely common and normal after that. And we think it's a way that our brain is processing it. So we know that REM sleep and dreams are really important for our brain processing memories and emotions. And so one way that happens with a traumatic event is we sort of almost relive it in our dreams, and our brain is processing through it. So it is unpleasant, but I think it's a sign that your brain is trying to work through it and process it. The same way that during the day, after a trauma initially, you're going to think about it a lot during the day, and things will remind you of it. You might have almost flashbacks where you feel like you're back in it. And again, that's your brain is like processing it. So with trauma, we think that typically, or in many cases, those symptoms will subside over time. Your brain is sort of able to process through it, but that doesn't always happen. So when it doesn't get through that processing to the other side, when the nightmares become chronic, or when those daytime trauma symptoms become chronic, that's when our brain just needs a little more help processing through it to kind of get unstuck. I guess in my experience, since I don't focus just on people who've experienced trauma, I see a lot of people who have nightmares and don't have trauma. I think the same kind of process can happen even with what we call idiopathic nightmares, where they're not linked to any real thing. So you could be having a nightmare that you're getting into a car accident. You've never been in a car accident, but it's almost like your brain just gets stuck in a habit and just keeps having that dream. So I think in the same way, it just kind of gets stuck. And so we need to just help it sort of move past that, create a different story, and move beyond it. So those two ideas, the trauma processing, the mood matching, is what we typically talk about in CBT-N. But then if someone has narcolepsy, I talk about how narcolepsy itself is probably a part of why you're having nightmares. You may not have experienced trauma, or your daytime mood might be fine, but maybe you're having these nightmares, and maybe it's the narcolepsy, at least in part, is creating these nightmares, these disruptions, the same way that narcolepsy creates things like sleep paralysis and hallucinations. Or again, with the example of RBD, which I'm currently doing some research on, people have these violent, aggressive dreams, and it's not at all correlated with how they are during the daytime. These are usually people that say, I've never been in a fight. I don't want to hurt anybody. I love my wife. Why am I yelling obscenities at her in my sleep? It's not at all related to who you are as a person. There's something about the neurological condition itself, whether it's RBD or narcolepsy, that is creating these dreams.
Thank you for that. So my final question for you is that if you could enter someone else's dream, just like a silent observer, kind of be in their head for an evening, just to see what their dream world looks like, who would you pick and why?
I love this question. I think the first people that came to mind are authors. So I tend to like speculative fiction and some fantasy. So I think the first person that came to mind was Octavia Butler, who is deceased but wrote some amazing books. And then N.K. Jemisin, who is still with us and has also written some amazing fantasy books. And she actually wrote a duology that involved some element of sort of sleep and dreaming. But I think someone that just is that creative and can imagine these amazing worlds, it would be really fun to be in their dreams for a night.
I have a weird one. I think I would love to understand what the heck dogs dream about, because I just watched my dog and she's like twitching and she seems to be having a good time. And then her breathing gets a little irregular. I'm like, what is happening in that dog's head? She happens to be smart, so I think I'm attached to her. It would be her, or I think maybe Albert Einstein, because I'd love to be in the mind of like a genius too. And that's very different than a dog. So a dog and a genius for me.
Yeah. I would love to be in a dog's dreams too. Yeah, that could be fun.
Dr. Mundt, thank you so much for shedding light on this very overlooked aspect of narcolepsy. I think it's something that hopefully through the conversation that we're having will highlight it and cause it to be one of these things that even more and more of us start to take interest in and talk about and obviously research about. So I appreciate you. What we will do is make sure that we know that your website is highlighted in any descriptions that we do, and also highlight where folks can reach out if they're interested in participating in your trial. I love the fact that it can be done remotely because, again, narcolepsy is pretty rare, so we got to find everybody to participate in this. And I'm hoping that this will lead to more and more recruitment for you, more people that you can help. So thank you so much for your time today. I appreciate you.
Thanks for having me. Yeah, this is such an important topic. I'm glad you're highlighting it.
Struggling with sleep? Dr. Kole is here to help. Whether you need a comprehensive sleep coaching program, suspect you have sleep apnea, or simply seeking a second opinion, she's available for consultation in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 10-minute review of services today to find out which visit is right for you at AskTheSleepMD.com and start your journey to better sleep with a trusted sleep expert.
Please be advised that the Sleep is My Waking Passion podcast is for entertainment and educational purposes only. It does not constitute medical advice. Always consult your healthcare provider for personalized guidance. For my full disclaimer, please visit AskTheSleepMD.com, and while you're there, don't forget to sign up for my free newsletter. Sweet dreams and happy listening.